Another challenge for families: respiratory viruses are out in full force, and so are vaccines offering protection, but few parents are scheduling those shots. Here to talk about that is Dr. Kristen Moffatt, infectious disease specialist at Boston Children's Hospital. Great to see you, doctor, as always.
Great to see you as well.
Of course, you treat sick kids throughout the year, but are you and your colleagues seeing more right now?
I would say we are, but I would also say it's feeling more like a typical respiratory season and what we were used to prior to the pandemic. We are seeing plenty of volume. Certainly respiratory infections of all kinds are really driving that volume. In terms of which respiratory infections are predominating, it seems like we probably have seen the peak of RSV. We're seeing plenty of it, but I do think it peaked in the last couple of weeks. But flu A in particular is steadily on the rise right now, and we're seeing bumps week by week in COVID infections too.
Yeah,
I sort of suspect, that may even increase further over the holidays and after the holidays as people gather. So I would definitely remind people to take all of those precautions in mind that we've become so familiar with, to do our best to keep ourselves safe and healthy.
Doctor, the CDC says it's tracking an increase in the number of kids developing a serious condition that's related to COVID-19. So what is this? What's the concern?
Yeah, the concern here is a condition people may remember referred to as MIS-C, or a multi-system inflammatory syndrome in children. And while it was fairly rare, it was a very severe illness. And we saw lots of cases of MIS-C in the first 2 years of the pandemic. For reasons that we don't completely understand, after the Omicron surge, we really saw a dramatic drop in MIS-C cases. This tends to impact mostly school-age children and some adolescents, occurs in the several weeks after a COVID infection. So any increase in those cases is certainly something to be aware of, but I would want to reassure parents that we're not seeing anywhere near the number that we were a year or two ago. And I'd also remind parents that we have very good data demonstrating that COVID vaccination and staying up to date on COVID vaccination is protective against MIS-C and reduces it.
Yeah, it's just not fun to be sick. Now, the CDC also says doctors should be doing more to encourage their patients to get vaccinated. What do you make of this?
I think that is exactly right. I think if you look at the vaccine coverage rates and the percent of people who are up to date on available vaccines, it's pretty dismal. So I think it really is a matter of taking time to talk to families about the importance of these vaccines, address any concerns they may have. We have so much better and more in-depth safety data, particularly around COVID vaccines in children. These have proven to be really very safe vaccines. But I would also say it's really important that we assure access to all of these vaccines for families. We certainly have all heard of the RSV antibody shortage preventative treatment we were so excited about, but families had a really hard time finding it. I hope that supply chain issue is not going to be an issue in future respiratory viral seasons. And I even heard from parents who are having a hard time finding COVID vaccines for their young children in particular. So I think that those are things that on a systematic level, we really need to address and make sure that families can find these vaccines too.
Happy holidays, Dr. Moffatt. Thanks for being with us.
Yeah, good to see you. Thank you.
Thank you, Dr.